patient must be having a rapidly progressive dementia. When we say rapidly progressive, it's usually less than 1 year or could be less than 2 years.
So what are the current diagnostic methods or probably the criteria that is needed for prion diseases, and how effective do you feel are they in the early disease detection?
So prion disease, the diagnostic criteria of CJD was developed by WHO, and recently CDC also came up with its diagnostic criteria. So more or less, it's like amalgamation of the clinical characteristics with the imaging and EEG findings which we get in CJD. The first thing is that patient must be having a rapidly progressive dementia, and when we say rapidly progressive, it's usually less than 1 year or could be less than 2 years as well. Most of the patients, of this sporadic CJD, they present within 4 to 5 months of disease onset. That is the median duration of the disease, and ultimately within a year of onset of the disease, patient, they die. So ultimately, most of the time, patient present to us within 5 to 6 months, not more than that. And within these 5 to 6 months, patient have extensive decline of memory, extensive decline of cognitive functions. They have behavioral abnormalities, they have hallucinations, psychosis, and then cerebral features as described. So such patients presenting to us with rapidly progressive dementia and having 2 or more of the following important clinical symptoms, as in pyramidal weakness or cerebral symptoms or myoclonus. Myoclonus is very characteristic finding of CJD patients, and or extrapyramidal symptoms like rigidity or dystonia as described. So apart from that, the patient must be having specific findings on MRI and EEG. So at MRI, what we see is that if it's sporadic CJD, there is a cortical rippling sign that is very characteristic of CJD, or there is basal ganglia hyperdensities. And on EEG, we get very characteristic periodic shock wave complexes. Now these periodic shock wave complexes are usually seen when the disease is very fulminant, and in the initial part of the disease, we can miss out on the EEG findings. So if we have a patient with rapidly progressive dementia and we are considering the possibility of prion disease, then it is very imperative for us to repeat the EEG at regular intervals. And there is quite a likely possibility that the initial EEG must have had missed those findings, and we see those findings in the subsequent EEGs. So these two are very important modalities. The other is the CSF testing. So in the CSF, we usually test for 1433. So the 1433 protein is positive, that is considered as a marker for CJD.